What brain scans detect vascular dementia? Imagine trying to piece together a puzzle of how your brain is functioning and what might be causing memory issues or confusion. Brain scans are like the picture on the box, helping doctors see the bigger picture. When it comes to vascular dementia, which results from blood flow problems in the brain, the main tools used are magnetic resonance imaging and computed tomography scans. These scans are crucial because they show the physical changes in the brain caused by blood vessel damage. Magnetic resonance imaging, or MRI, is often the go-to scan for detecting vascular dementia because it provides detailed images of the brain's structure. It can reveal areas where blood flow has been blocked or where small strokes, called lacunar infarcts, have occurred. MRI uses different sequences to highlight various features. For example, T2 weighted and flare images are excellent at showing white matter changes, which are common in vascular dementia. These images can also detect tiny areas of bleeding known as microbleeds, which are signs of small vessel disease. Diffusion-weighted imaging helps identify recent strokes by showing areas where water movement is restricted, indicating recent ischemic injury. Advanced MRI techniques, like dynamic contrast-enhanced MRI, can even show if the blood-brain barrier is disrupted, which is often linked to vascular problems. Overall, MRI is very good at showing patterns of brain atrophy and vascular lesions that contribute to cognitive decline. On the other hand, computed tomography scans, or CORT scans, are more widely available and faster to perform. They are especially useful in emergency situations or when MRI is not an option due to medical reasons. CORT scans can detect larger strokes, significant brain shrinkage, and blood vessel abnormalities. They are also helpful in ruling out other causes of dementia symptoms, such as tumors or large hemorrhages. However, CORT scans are less sensitive than MRI for spotting small vessel disease or subtle white matter changes, which are often seen in vascular dementia. Sometimes, doctors use positron emission tomography scans, or PET scans, to get additional information. PET scans are more commonly used to look for Alzheimer's disease by detecting amyloid or tau protein deposits. But in cases where vascular and Alzheimer's pathologies coexist, PET can help show how the brain's metabolism is affected in different regions. This can be useful for understanding complex cases of mixed dementia. In clinical practice, diagnosing vascular dementia involves combining the imaging results with a thorough clinical assessment, memory tests, and blood work. MRI is usually preferred because it offers the clearest view of small blood vessel damage and white matter changes. However, if MRI is not available or safe for a patient, a CORT scan can still provide valuable information about larger strokes or structural brain changes related to blood vessel issues. To sum up, MRI and CORT scans are the main tools used to detect vascular dementia. MRI is more sensitive for small vessel disease and white matter damage, making it the preferred choice for detailed assessment. CORT scans are useful for identifying larger strokes and ruling out other causes. PET scans can serve as an additional tool in complex cases involving mixed types of dementia. These imaging techniques are essential in identifying stroke-related brain injuries and vascular changes that contribute to cognitive decline, helping guide stroke prevention and overall brain health strategies. Always remember, if you or a loved one are concerned about brain health, consult with a healthcare professional for personalized advice and appropriate testing.